Cerebrovascular accident or stroke.
Cerebrovascular accident or stroke is sudden loss of brain functioning resulting from interruption of blood supply to a part of the brain. Types of stroke: hemorrhagic stroke and ischemic stroke. Hemorrhagic stroke is caused by bleeding into the brain tissue, the ventricles, or subarachnoid space. Ischemic stroke is due to large artery thrombosis, caused by atherosclerotic plaques in the blood vessels in the brain. Cardiogenic embolism associated with atrial fibrillation. Stroke can cause wide variety of neurological deficit, depending on the location, the size of damage, and the amount of collateral blood flow. General signs and symptoms are weakness, drooping of face, weakness of arm or leg, confusion, loss of balance, blurred vision, severe headache, homonymous hemianopsia. Homonymous hemianopsia means loss of half of the visual field. Hemiparesis, weakness of the face, arm, leg on the same side due to lesion in the opposite side. Hemiplegia. Hemiplegia is the paralysis of face, arm, leg on the same side due to lesion in the opposite side. Ataxia, unsteady gait and inability to keep feet together. Dysarthria is difficulty speaking. Dysphagia, there is difficulty in swallowing. Aphasia, loss of speech. Expressive aphasia, the patient is unable to form words. Receptive aphasia, the patient is unable to comprehend the spoken word and can speak but may not make any sense. Global aphasia, this is a combination of both expressive and receptive aphasia. Apraxia, inability to perform a previously learned action. Investigations: CT scan, cerebral angiography. In CT scan, ischemic infraction are not seen for 8 to 12 hours. CT scan is used to confirm the is it ischemic or hemorrhagic stroke. In MRI, scan shows the infraction, cerebral edema, hemorrhage, arteriovenous malformation. Cerebral angiography help to determine specific cause of stroke. Management of hemorrhagic stroke. The treatment of a hemorrhagic stroke depends upon the cause of the bleeding. Example: high blood pressure, use of anticoagulant medications, head trauma, blood vessel malformation. Most patients are monitored closely in an intensive care unit during and after a hemorrhagic stroke. The initial care of a person with hemorrhagic stroke includes several components: determining the cause of the bleeding, controlling the blood pressure, stopping any medication that could increase bleeding. Examples: warfarin or aspirin. If the patient has been taking a blood thinner, specific treatments or transfusions of blood clotting factors may be given to stop ongoing bleeding. Medical management of ischemic stroke are administer recombinant tissue plasminogen or other thrombolytic agents, such as streptokinase or urokinase within 3 hours from the symptoms begins. Other treatments are anticoagulants such as heparin, warfarin, anticonvulsants, antihypertensive, osmotic diuretics, to decrease intracranial pressure, position, elevate the head end at 30 degrees. Surgical management of hemorrhagic stroke are decompressive craniotomy, when a patient's life appears to be threatened because of the pressure effects of a blood clot in the brain. Aneurysm clipping, patient have aneurysm with bleeding. Surgery for arteriovenous malformation. The nurse is assessing the client experiencing a left-sided cerebrovascular accident. Which clinical manifestations would the nurse expect the client to exhibit? A. Hemiparesis of the left arm and apraxia. B. Paralysis of the right side of the body and aphasia. C. Inability to recognize and use familiar objects. D. Impulsive behavior and hostility toward family. Answer is option B. A. Left-sided CVA results in right-sided paralysis, right visual field deficit, aphasia, and altered intellectual ability. The client diagnosed with a right-sided CVA is admitted to the rehabilitation unit. Which intervention should be included in the nursing care plan? A. Turn and reposition the client every shift. B. Place a small pillow under the client's left shoulder. C. Have the client perform quadriceps exercises 3 times a day. D. Instruct the client to hold fingers in a fist. The correct answer is option B. Placing a small pillow under the left shoulder will prevent the shoulder from adducting toward the chest and developing a contracture. The 88-year-old patient is admitted to the emergency department with numbness and weakness of the left arm and slurred speech. The CT scan was negative for bleeding. Which nursing intervention has priority? A. Prepare to administer tissue plasminogen activator. B. Discuss the precipitating factors that caused the symptoms. C. Determine the exact time the symptoms occurred. D. Notify the speech therapist. Correct answer is option C. The nurse must first determine when the symptoms started before administering tissue plasminogen activator, a standard of care. TPA must be initiated within 3 hours of the start of symptoms because, after that time, revascularization of necrotic tissue, which occurs with the administration of TPA, increases the risk for cerebral edema and hemorrhage.